couple of videos ago, we were talking about RSV, Respiratory Syncytial Virus. That virus is very virulent, meaning it doesn't take a lot of viral particles to spread the infection from one person to another. We talked about, I showed you an image of the virus. In the image, I kind of said I didn't really make much of it, so I'm going to go back to that image right now. I just want to let you know that RSV can have two distinct forms. A filamentous form, kind of like this one here, and a more circular form, maybe a little bit like that one right there. In fact, let's try to show you another image of that. Here you go. RSV filamentous form and circular form. All right. Again, this is not actual medical school, but I am trying to give you some of the fundamentals to help you understand a little bit more about what's happening in the world around you. And as we continue on, you'll learn more. So, the death rate for RSV amongst children in this country is actually quite low. It's only about maybe 100 to 500 children a year. And I think it's largely because here in America, we have a pretty good health system. If a parent sees a child and the child's getting sick, the child looks like it's struggling to breathe, like we talked about, that parent usually brings the patient to the ER. Here in the emergency room, I assess the patient, and I will typically call a pediatrician and admit the patient, because a baby who cannot breathe is a baby in distress, and we take care of our people. So in America, the death rate is quite low. In a non-developed country, or a country that does not have a lot of hospitals, I would appreciate, or I would think that the death rate is probably quite a bit higher. Anyway, here in the United States, RSV amongst children, death rate is fairly low, usually less than 500 deaths per year. Here's something you didn't know. The RSV death rate amongst adults, particularly older adults, how many do you think that is per year? And this is just an estimate. You know, an estimate usually means that there's more than what is being reported. The estimate for RSV deaths in the United States amongst older adults is about 14 to 15,000 deaths a year. That's a lot of people dying from an infection that is spread from person to person, spread by coughing and sneezing, spread by touching one bad thing and then touching your mouth. Be careful with that. I'm going to wrap up my discussion about RSV by saying that amongst children under the age of 1 who'd get an RSV infection, they have a fairly high rate of developing reactive airways disease or asthma or asthma-like symptoms with wheezing during their lifetime. Meaning, a child under the age of 1 who gets RSV may turn into a child at the age of 10 who has wheezing and asthma problems, may turn into an adult who at the age of 40 or 50 may have wheezing problems and asthma as well. Why is that important? Because if you can prevent your child from getting RSV under the age of 6 months, you can actually help grow up a kid who's going to be able to breathe better his entire life. So an ounce of prevention in maybe not letting your child play with other sick children during the winter time when your child is 4 or 5 months old, maybe not letting your child, your baby, be held by sick adults at church or at other gatherings might be a good thing. Go ahead.
Sorry, the sun's here.
Oh, sorry. Okay, I'll be in just a minute.
He'll come in just a moment.
That might be a good thing to help prevent your child or your baby from getting RSV. You just kind of have to think outside the box a little bit. Now with this virus going around, COVID-19, everybody's very afraid, and now people are being cautious, and people are looking and seeing, oh, that person over there is coughing and might be sick, maybe I don't want to get too close to them. Well, this COVID-19 virus, which is bad, has a death rate currently in the United States of less than 200 people, and today is March 19. Whereas the RSV virus here in this country already this year has a death rate amongst older adults much higher than that. Are you picking up what I'm putting down? Are you understanding it? I hope so. Alcohol-based hand sanitizer also works. It works better when it's in your hand and not on the floor.